Good morning, dears. I am Dr.Annapoorani. Today we are going to discuss a case study on anterograde amnesia. Anterograde amnesia is a loss of the ability to create new memories after the event that caused the amnesia, leading to a partial or complete inability to recall the recent past, while the long-term memories from before the event remain intact. This is in contrast to retrograde amnesia, where memories created prior to the event are lost while new memories still be created. Both can occur together in the same patient. To a large degree, anterograde amnesia remains a mysterious element because the precise mechanism of storing memories is not yet well understood, although it is known that the regions involved are certain sites in the temporal cortex, especially in the hippocampus and nearby subcortical regions. Signs and symptoms. People with anterograde amnesia syndromes may present with widely varying degrees of forgetfulness. Some with severe cases have a combined form of anterograde and retrograde amnesia. Sometimes it will called as a global amnesia. In case of drug-induced amnesia, it may be shorter-lived and the patients can recover from it. In other cases, which has been studied extensively since the early 1970s, patients often have permanent damage, although some recovery is possible depending on the nature of pathophysiology. Usually, some capacity for learning remains, although it may be elementary. In cases of pure anterograde amnesia, patients have recollections of events prior to the injury but cannot recall day-to-day information or new facts presented to them after the injury occurred. In most cases of anterograde amnesia, patients lose declarative memory or the recollection of facts, but they retain non-declarative memory, often called the procedural memory. For instance, they are able to remember and in some cases learn how to do things such as talking on the phone or riding a bicycle, but they may not remember what they had eaten earlier that day for lunch. One extensively studied anterograde amnesia patient condemned HM demonstrated that despite his amnesia preventing him from learning new declarative information, procedural memory consolidation will be still possible. It reduced the power. He, along with other patients with anterograde amnesia, was given the same age to complete day after day. Despite having no memory of having completed the maze, the day before, the unconscious practice of completing the same maze over and over reduced the amount of time needed to complete it in the subsequent trials. From these results, despite having no declarative memory, the patients still have a working procedural memory. This supports the notion that declarative and procedural memory is consolidated in different areas of the brain. In addition, the patients have a diminished ability to remember the temporal context in which objects were presented. Certain authors claim that deficit in temporal context memory is more significant than deficit in semantic learning ability. Causes. The main cause of anterograde amnesia is usually occurred in two ways. One cause is benzodiazepine drugs such as midazolam, flurazepam, lorazepam, tempazepam, nitrazepam, trilozolam, clonazepam, alprazolam, diazepam, and nimetazepam, all of which are known to be powerful amnestic effects. This has also been recorded in non-benzodiazepine sedatives or EZ drugs, which act on the same set of receptors. And the illness through much also cause anterograde amnesia if it causes which it is inflammation of brain tissue. These are the several types of encephalitis, one of which herpes simplex encephalitis, that is we call as HSV, left untreated, can lead to a neurological deterioration. How the HSV gains access to the brain is unknown. The neurological deterioration. Amnesia is seen in the patients who, for the reason of preventing another more serious disorder, have parts of the brain known to be involved in memory circuits removed. The most notable of which is known as medial temporal lobe, that is we call as MTL memory system. Described below. Patients with serious ornamentum and with MTL may have the either side of both structures that is removed. In addition, patients with tumors who undergo surgery will often sustain damage to these structures. It is described in case below. Damage to any part of the system, including the hippocampus and surrounding cortex, results in the amnestic syndromes. This is why people who suffer from the strokes have a chance of developing cognitive deficits that results in anterograde amnesia. Since strokes can involve the temporal cortex, and the temporal cortex houses the hippocampus. Pathophysiology. The pathophysiology of anterograde amnesic syndromes varies with the extent of damage and the regions of brain that were damaged. The well-described regions indicated in this disorder are the medial temporal lobe, that is we call as MTL, basal forebrain and formax. Through most researchers, including, have found that the consolidated process is spread over the several hours before translating from fragile to more permanent state. Others, including Brown-et-al., possess that memory consolidation can take months or even years in a drawn-out process of consolidation reinforcement. But does not affect the other such memories. Next, we are going to discuss the case history of a patient. Here, we have to study the variables that is including in the patient case history. That is, it includes the name, age, sex, religion, employment, reliability, education, occupation, socio-economic status, marital status, habitat, etc. That is, here, history of presenting what problems the patient is having, present illness, mode of onset, course of illness, duration of illness, precipitating factor, past history, if it is anything, premorbid personality, we have to study in the case history. Then we have to find how far the patient is having that kind of complaints and duration. Thank you guys. Thank you once again.